It's 7 a.m. on day one of Urgent and Immediate Patient Care Week. Students from paramedicine, pharmacy and medicine are beginning to arrive. Student graduates from these professions will shortly be expected to attend to the real healthcare needs of patients, many of whom may be acutely unwell. At this stage of their training, many students are still nervous and feel ill-equipped to manage such situations. Over the following 4 days, they will gradually learn these skills through simulation scenarios, debriefing and classroom learning activities that will enable them to better communicate effectively with other health professionals and in so doing, save lives.
It doesn't really matter.
Hi, my name's William Allen. I'm a trainee intern just at the GP across the road.
Mm-hmm, yeah.
I have a 20-year-old male here named Tiffany. He came in just before after being rear-ended by another car in the parking lot.
Yeah.
His car took some structural damage.
Students first learn how to structure their communication effectively so they can efficiently and accurately convey important patient information.
Complaining of some neck pain in a similar area, so I'm worried that there might be a further problem in the spine. So I'd just like him to come in for an ortho review, just see if there's any more problems, and an X-ray, if that's okay with you.
Yeah, sounds good. Yeah.
Awesome. See you.
See you later.
How did it feel, Daniel, when you received that call?
At first I was a bit nervous, because, Eddie sometimes get scary calls, but no, he handled it well, I got the full story succinctly, yeah, it's good.
It's pretty interesting to see the different perspectives, especially with the medical students, of how they've been taught things opposed to how we've been taught things. And yeah, I haven't seen pharmacy students before ever, so that's really interesting.
So far, so good. I mean, we're fresh into the course. A little bit sort of nervous and excited to see what's coming up as we go through the week.
I guess everyone watching is one thing, and that you might make a mistake, but it's a good chance to know now what you're doing wrong.
What even number they stop at?
So they're alert, they're breathing, any change in colour, and just their general in a bed.
And before ABC, there are a few other things that we tend to talk about.
In the various simulation scenarios, people from within each profession will be encouraged to take a leading role, which may be a new experience for some students.
I guess pharmacy students, lots of them are quite quiet. They're not used to being leaders, I guess, especially in a healthcare situation. They don't have a lot of experience with simulations. Being part of this really helps them to see what their role is. It helps them to realise that they do have knowledge that doctors and paramedics and nurses don't have.
The patient is an adult with known asthma who's very breathless.
One of the key messages that we know is that know what is each other's role. For example, when I was in there, the doctors basically did the vital signs observation, and he didn't exactly know that as pharmacists we were actually trained to do that as well. And when the paramedic came in, she drew up the adrenaline and everything. But then what the paramedic didn't actually know is that as pharmacists, we can actually draw up the adrenaline for them.
The debrief is where the gold is. That's where the students get an opportunity to unpack what happened in the scenario. So the scenario, they get to practice and use some of the skills. In the debrief, they get to unpack what assumptions was I making when I did that action. Did that communication tool work? Did the people I was speaking to, did they hear the same things that I was trying to communicate? Or wasn't that level of communication or that particular word useful? And so it gives them an opportunity in a safe environment to be able to think, what was it that I was thinking? Why didn't I do that? Or why did I do that? And by getting down to their underlying assumptions and underlying beliefs that we all have about the world, it's much more likely that they will change their behavior and change their actions when they go to do another scenario, and more importantly, when they go into their clinical space and look after patients.
When we walk out of a simulation, it may have gone well, it may have not gone so well, and then you'll be walking out of the simulation room thinking, oh my God, why did I do this? I could have potentially done that. It could potentially be better if it did this. But when we went out into the debriefing session, it's a really supportive session, and people don't actually blame you for what you do wrong. They actually help you in a really supportive way.
Morning tea on the first day sees many of the students remaining in their specialist groups, But it doesn't take long for the shared experience and stress of the scenarios to open up new lines of communication and discussion.
I think the discussion you get between the different disciplines is really good. Like, it's the first time we've actually had a day with paramedic students, for example, and so they're contributing a lot of stuff that we hadn't really thought about, or they're impressing us in like a lot of different ways as well. And so,
now, right?
Yeah, for sure.
And really, like, think simple, like reassurance, keeping her warm, talking to her, distracting her. That's 4 things you can do to get her mind off this sort of, oh no, and like telling her that the ambulance is coming, the pain relief is on its way.
One of the most challenging scenarios that students face on the first day is a community mass casualty. In this, students will have to cope without their usual equipment and are forced to improvise with what is at hand.
Seems like there'll be multiple casualties, so tension, you must
Yes, chuck a chest right.
It sounds like the start of a joke. There's a paramedic and a pharmacist and a doctor, and we're all off duty, and we come up to a car accident. Car is in a ditch on a big country road. Cyclist has been knocked off as well. So we talked about sort of our roles before we went in, and because it was a pre-hospital domain, the team felt that I would be the best person to make the initial decisions. So when we went in, I triaged the patients according to like their responsiveness. That one's vocal. The doctor can go look after that patient because that will be her skill set, and the pharmacist is going to be my extra set of hands.
Okay, thank you very much. I'll let the ambulance know they are en route to you. So just make sure you're visible by the road, but staying safe and not endangering yourself. Okay.
During the simulation, the staff are evaluating the students within their prescribed roles, noting both good practice as well as those areas that might be improved. It is this, together with the students' perceptions, that provide the material for the debriefing.
I was completely blank. I was like, oh, when I picked up the phone, I was like, should I do it this far or not? Because even though
For many students, it may be their first chance to confront situations where medical intervention may be unsuccessful.
She kept asking where he was. That's my neighbour. I'm so upset. Where is he? Asking about him. We just told her that he's already been seen, and just left it at that, because there's no point further distressing her at this point. So
I think with simulations it's really hard because it sort of puts you on the spot, and you have the knowledge and you think, if I'm faced with a situation, I'll know what to do, I'll be able to take charge. And then when you're in the spot, you know, emotions can be running freely and you sort of have a mind blank and you're not quite sure what to do. So I think it is good in a way that we are put on the spot and we see, okay, this is what we're good at, this is what we need to work on. And you don't really get that experience unless you do these simulations. You do experience a lot more emotions than you think you will, and that's probably a good thing and will probably stick with us longer because of that and help guide future learning.
we haven't had any training with other students, so today has it's given me personally like a glimpse into the minds of these other professions. What are they looking for? I didn't know that a pharmacist, the first thing they want to know is the patient's medications. The pre-hospital setting would be my domain, and we pick up the patient in the pre-hospital setting and we take them to the doctor. So there's these different professionals and these different tiers, and I think we need these scenarios in our training just so that we can learn to bring out the strengths in each other and work together to coordinate the best care for the patient.
It's quite unique for us going over things like mass casualty protocol, and there's a lot of emotions and stuff. It's an acting-based scenario, although it becomes really quite real life. And one of my medical colleagues who was thrown in there just felt really overwhelmed and did extremely well, but you could tell she was on edge the whole time. And for us observing, at times it's quite humorous to see what people do in those situations, although it's also quite serious, and you feel your sort of, your blood pressure start to rise and like just throw yourself in it. And then it's good having the discussion afterwards because you can actually debrief and reflect on exactly what was going on.
After the adrenaline rush of day one and the unexpected road crash, day two begins with palliative care. Here the emphasis changes from potential cure to providing relief from the symptoms and stress of a serious illness. The goal here is to listen to the wishes and needs of the patient and their family.
You get a feel for what the person is going to say about their desire for treatments and intervention even before you get to those pages.
I knew we had some discussion and the palliative care team were coming in today. I rode my bike home and caught up with my grandma, who's actually just recently filled out one of the advanced care plans, so I actually had a look over that with her. And she recently was discharged from hospital, and so just talking to her about that, which is pretty interesting and relevant for today. My grandma has been quite vocal about what she wants recently, and has one of these care plans filled out, and so she's more than happy to talk about it. And so it's just good, like sort of going over that with her, and I think she just likes us grandchildren stopping in and spending some time with her.
So the patient you're going to meet soon is Frankie Kelly, who we've talked about in the previous session, and she or he is being brought into the emergency department by ambulance after pressing a St John's alarm. So
yeah, I was quite anxious going in. It was the first one I'd done for the week, and I knew it would be quite an emotional scenario because we were warned it was a palliative care case. Obviously it's been the topic for the day, and so I wasn't quite sure how I would react to what I would be faced with. Had some idea but not much. And then when I walked in, the patient was in tears and was very overwhelming and very emotional sort of immediately. And I was just sort of thinking, what do I do? What do I say? And there's often no right or wrong thing. So I just sort of sat with the patient, gave her some tissues, sat in silence, which is often quite uncomfortable for me, but just made do with it today. And it also brought back previous memories because I'd been on oncology last year as one of my placements, and brought back those memories of death and dying. And so it was sort of hard dealing with that at the same time, and then some personal experiences I'd had as well. So all of that was sort of running through my head as I was faced with a patient, and then dealing with that scenario at the same time as having these thoughts running through my head. But hopefully it came across, less haywire, and sort of like there was a plan, and like I had some idea what I was doing.
The emotional content students encounter during these first 2 days can be confronting. Debriefs encourage students to acknowledge and work with the complexity of what they are feeling. However, doing so can make them feel uncomfortable.
There was someone who felt that being vulnerable and debriefing after a situation wasn't really appropriate for them, that if they were to expose themselves to that, they would be carrying around too many memories of difficult situations that they've been involved with.
It's an interesting dynamic in that the pharmacy students, there are only 1 or 2 students in each group, so there's no opportunity for them to hide. As a debriefer, I'm working on sort of drawing out their knowledge. For example, in a scenario this morning, there was morphine and the patient thought it was for pain relief, and the student initially wasn't confident enough to convey to the patient that actually it was for shortness of breath. So we talked about that a little bit more in the debrief scenario, and that I think helped the student.
There's always people within a group who'll come forward and talk. I'm one of those people, and because I'm not a quiet person, trying to focus on the quiet person, not to make them feel uncomfortable, but to have that level of a relaxed environment where they feel that they can come forward and talk. It's fine, trying to find that balance.
That last sim was probably the most intense one I've done on this course. Because that was the end of life one. So we had this oncology patient that I'm transporting home to die, basically. So, yeah.
Today I found really well, especially communicating around sensitive subjects such as palliative care and death and dying, those things you'd never think about, but it is quite important to think about. And then also seeing other people's perspectives on it, and some people in the class might be a little bit more clinical about it, and other people are quite emotional about it, and you know, if you're quite open-minded and open-thinking, it's good to, you can take it all in, absorb it all in, and just feel good about it.
From my point of view, the students are confronted by the palliative care side of it. They come into paramedicine to fix people, and they're focused on their procedures and fixing problems. And the palliative care side isn't about fixing a problem, it's more about caring and taking people in home to die and dealing with that and dealing with the emotion.
I think I was really nervous before the sim started because I thought, what am I going to say? But I was most scared about being useless because I had this letter that said what to do. But when I went in, I just told myself before I went in, be professional about it. So I went in and talked to the patient, and I felt relieved actually to have that letter because it gave me something to do.
Ended up coming to my turn, and I suppose there were some similarities from a discussion I'd only had the night before with my grandma, so it was interesting, yeah.
So if I walk into the room there today and I have a complete mind blank, I hope I can stay calm. Often that's not necessarily the case, but I think what I'll do is I'll take a deep breath to start off with and sort of reevaluate the situation, so kind of assess why I'm having a mind blank, and then sort of start small and slowly build up my thought process, take it small steps at a time, and hopefully eventually things will start to fall into place. And we know the real world will throw curveballs and you never know what you're going to get, so you know, fingers crossed that it does work out.
This is our patient. This is Lindsay. Hi, Lindsay. Lindsay's gone to sleep.
Day 3 sees nurses joining the hospital team, together with mannequins as patients. On first viewing, the 3G sim man may not look particularly lifelike, but this belies the sophisticated technology beneath its skin. Students can draw blood, measure vital signs, and even have a conversation with the patient.
If you are feeling for a pulse, you just need to press down and then just raise your finger slightly, and then you'll just feel it actually pulsating under your fingers. So please, this is your opportunity to actually have a feel. Do you want to have a listen to heart and breath sounds? Well, if you take the temperature, we will feed the information into you.
It's fun. It's intense, but it's fun. Every course is different. We keep doing the same situations like in every course, but the students react differently. And I usually role play as patients. They still ask me like new questions. So the questions that I haven't come across in the last 15 courses. So we do have scripts for all these patients. We have to strictly follow the script. But the trick is sometimes they don't get to the problem straight away. So you have to steer them along, ask them the right questions as a patient, and keep reminding them about the problem that you have complained to them so that they do try to act fast on it and try to give them subtle clues all along the session.
Simulation for the students, it looks real. You know, when they come in, they interact as if it is a real patient. And some of them might get stressed, like real life situation. But most of the students, they act as if it is a real situation. They say that this sort of simulation should have started early, maybe in the 4th year, because it's an experience for them. They might not have the opportunity, the real opportunity to have experience with patients. So this is a chance for them to meet together, work interprofessionally. And I think it's very useful. It's very useful. The students love it.
It's quite nerve-wracking initially. You're sort of, you're sitting out in the room waiting to be called to go in, and just sitting there and you're sort of like thinking over the various scenarios. You don't get given much of a background of what you're meant to be going in to do. We'd been paged by the nurses to come and review a patient and you didn't really know what it was about. and you just obviously run through your structure, your ABCDEs, and remember what you can in the moment, and just try and keep good communication with the nurses, and call for help when necessary. And because it's your first time doing that, you're obviously not going to get it perfect, but you do as well as you can, and then you feel a bit unsure about it, and then it all comes out in the debrief of where you could have improved, and little things that will be good actually for a real life scenario, I suppose.
For everyone, observation of their teammates provides many opportunities to learn from each other and critically reflect on their own practice.
That was the other intense moment that I was thinking about, was actually observation, and I didn't realise it would be that hard. And standing behind the glass, not being able to communicate with my colleagues, seeing the big picture and knowing what I would do in that situation, and maybe just wanting to reach out and suggest something to them but not being able to. So I guess that ended up coming out in a way where I started a conversation with the other medical students that were with me.
Because it's already charted for a bit, in terms of maybe asking the surgical registrar about the bloods.
Yeah? Okay.
Hi Lindsay. So we've just been talking, and so with the chest pain and the ECG, it looks like...
This is the part.
Probably most worried about just being bored for a week. It was good because I hadn't seen that presentation before in a person, so my mind was just running with anything, and I wasn't too sure what was going on, and it was hard in the moment to step back and think clearly about it, and it was really useful to have a pharmacist in there as well, because she knew what was happening with the medications, and I got good advice from her.
So those of you who are new to the timetable, essentially, this morning we have got...
Since the course began 5 years ago, it's developed into a successful collaboration between the University of Auckland, Auckland University of Technology, and the Unitec Institute of Technology. To run the course 7 times each year is not without its challenges. Success relies on cooperation, goodwill, and countless hours for all those involved.
So logistics are big. It does take a lot of input of faculty and so on, but actually by international standards, we're running this very lean. In fact, we're doing it really very efficiently, and we know we're still getting good outcomes.
It's not only Jane that is positive about the course. Students too are now seeing changes in their own practice. They appear more confident and are communicating freely between their professional groups. Even those who may have had initial reservations have become converts.
I'm really glad I had to do it, because watching from the observation room, it would have been easy to think, oh, I would have got that. That was easy, but it wasn't when you're in the moment. So I'm glad I got put through it. Yeah.
Some of the medical students highlighted the fact that there were some parts of my handover that were missing, which I at the time hadn't realised, but it was a great moment for me to be like, oh, okay, my mind just blanked, and now going into the next simulation, I know that I need to be looking for these things and making sure I've got all of my handover there.
It was the conversation back and forward between the nurses and the medical students that brought about a lot of aha moments.
Straight after a simulation, you just decompress completely, and so thinking back into the situation, putting yourself back to where you were, is really helpful.
In terms of attending a real-life ward call, I'm sure for the first time it'll be quite emotional, and you're still going to be nervous, and you deal with whatever situation comes to hand, but it is quite helpful having all this experience to draw on, and at least you've kind of done it before. Yeah.
I'm not here to make friends. No, I'm kidding. No, I've made lots of friends. Yeah, I've loved getting to know the pharmacists and the nurses, and the paramedics were fun too. Yeah, they were all a good group of people. Yeah.
It's so worth your time. The best accidental placement I ever had.
I love the moments when the students, during the debriefs, or sometimes actually in the scenarios, come out with absolute pearls, and you can see they've got a huge sudden insight. One of those, sometimes called a threshold moment, and suddenly they've walked into a new world where they understand, they trust and respect the other group, they know they can share, they know they're all in it together, they're a team looking after the patient, and the patient's part of it. That is what I get up for in the morning to come to these courses, because they're very hard work.